I love working at CRC because it's a great place to feel a real part of. The employees feel like family. It's very rewarding to know that you're helping the families and adolescents in Oklahoma with substance abuse issues and mental health issues. These people really are like family. I actually enjoy being here Monday morning, first thing. I love coming in. It's not like, I gotta go to work. It's just a great place to be. The employees all get along really well with each other. We have a lot of events like potlucks and stuff that we just all really get along really well. These people are like family. They make you feel very comfortable and are always willing to help each other out and are very easygoing when they need to be, but very serious when they need to be. I am often approached by people and ask where I work, and when I tell them, they will praise CRC, how wonderful all the help they give to the community.
I think we have some of the greatest staff here, that they care about the consumers, they care about the services and the quality of services they provide. They are very enthused about the integrated care. They have worked hard and diligent to get it all up and running, and to them, they see it as saving lives, and that's what they're here for. We have increased our number of wellness events, so our consumers come and we participate in wellness events here at the facility, where we're engaged community members to come in and talk about healthy living styles. We have walkathons. Everybody just is embracing this, and they have tough jobs, but they smile.
This has been a difficult year for us with all the budget scares. During a 3-month period, we actually had 14 LPCs resign because they didn't know if they were going to have jobs. So during that time, everyone else had to step forward and volunteer to work double shifts, and in all departments, not just licensed professionals. So we had to pull together and do more with less. The teamwork has just been phenomenal, everyone jumping in.
I really like to work here. I've been working there since October of 2009. And I enjoy working with everybody. I enjoy what I'm doing. I don't think there's ever a morning that I ever get up and say, boy, do I have to go to work? You understand? It's never like that. I always enjoy, because I enjoy what I do, and I enjoy the people I work with, and I enjoy working with the consumers also. So, and I think we really deserve it.
In the past year, Central Oklahoma has had amazing change. We switched from the medical model to an interdisciplinary team, multidisciplinary team model. And we really changed the way that we provide care to our consumers and how our staff interact with each other. I'm not going to say it's been perfect, it's been bumpy in areas, but we have come through that, and the changes are phenomenal. We've changed some of our administrative processes, we've changed some of our financial processes, and I think our facility has reaped the benefits of that. And we're not done, but we have seen that the changes that we've made have benefited in lots of different ways, clinically, administratively, in terms of the training that we're able to get our clinicians, and just the camaraderie, like the way that staff take care of each other in our efforts to take care of our consumers. And so I think we're very deserving of Facility Year. I'm biased, but I think we're deserving of it this year.
We serve the entire state, so we get to serve Oklahomans from all over, not just local to our immediate area. And so that's one of the things that I think is really unique about our program.
In this last year, it's just been sort of like the trifecta of goodness. When the consumers leave, they fill out a survey form for the Department of Mental Health about satisfaction of the program, and there's 25 specific questions there that they are asked. And out of those 25, we got like 90 and above in 21 questions. So we know that we're doing something right with the consumers, and that just felt really good to us. And then we had our CARF review and our provider cert review from the Department of Mental Health for a 3-year. And we did really well. We scored 95% on our department review. So we just felt like all the pieces came together for us. And we have struggles like everyone does, but we can pull together. and overcome those things and still provide quality care for the consumers, which is our #1 goal.
We have a really low turnover rate, so a lot of us have been working together for years. We love what we do, and we love working together.
One of the things we talk about here, Oak Crew's goal is to change the world one relationship at a time. And that's what they do here. Our recovery support specialists, which are our direct care staff, work with each consumer to create an individual relationship that they start at second one when they come through the door. I mean, literally, we talk about which hand do you shake when they come through the lobby first. We talk about how do you greet them, when do you interact. The key is developing a relationship. It's not turning it into a clinical, it's turning into a relational interaction. And I think that's the strength. That relationship is the reason why we can take a 70% involuntary population and get a 90% customer satisfaction survey. So you're talking a 4 or a 5 on a 5-point scale, and 90% of the people who come through. We still have an 86% employee satisfaction. It shows you that we're working together as a team. It shows with Provider Cert giving us the second set of certification with special distinction. It's the second time in a row. CARF, when they gave us the 3-year last year, even asked us if we went out and got a private consulting agency because we did so well on all the stuff. That by itself just shows a lot about how they're focused on the relationship. That's why we do it. That's why it stands out. That's why the relationship is so important, because that's what we've done. We've tooled ourselves and tooled our situations to facilitate that relationship.
I believe that OKIC has been instrumental in transforming the way that mental health services are delivered here in Oklahoma County, if not statewide. We have transformed the crisis center as from a place where people wind up to a place where people can start and really have access to the wider range of services that us as an agency and our community partners have to offer.
We have to, a lot of times, because the community is changing, mental health, like what we're doing in the community is always evolving. What the department does is always evolving. We kind of help start a lot of things that haven't necessarily been done before.
In this past year, we've really worked very closely with the community mental health centers to really provide a strong, warm handoff. I believe that we've been pretty successful in doing that. We also work closely with the assisted outpatient treatment teams to help people who are having difficulty with engaging into traditional services get put on an intensive team to help engagement. And we also work very closely with the PAC teams for those individuals who are suffering with severe mental illness, who are often the most marginalized in our system.